Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
So, John, on one of our most popular episodes this year, we asked this question: is it getting worse to be a nurse? And we know a lot about healthcare, and your mom was a nurse, as you've told us, but I don't think we could really answer that question directly. So we had a great idea, which was, how about we have Nurse Alice Benjamin on the show? She's had a really remarkable career in nursing over the past 20 plus years, and she has become more recently a high profile presence on TV and radio and sharing her perspective on healthcare. John, what do you think of that idea?
I think it's awesome to give more voices to nurses. Nurse Alice, thanks for joining us. Can you maybe, before we get into whether it's worse to be a nurse now, maybe talk a little bit about how you got into nursing? What drew you to it, and kind of what gets you excited about being a nurse?
Yes. Well, thank you for having me. I'm delighted to be here, and I'm very passionate about being a nurse. 24 years later, same passion, same fire. I was actually inspired to become a nurse because of my dad. My dad was a retired service person. He was in the Navy. And at those times, they would say, smoke them if you got them. So we would go on a smoking breaks, right? So he picked up that habit, which we know puts you at risk for high blood pressure. Then you have strokes and heart attacks, and a multitude of things can happen with your health. And as the eldest, I found myself helping my mother take care of my father. Ultimately, my dad died of a massive heart attack. And, even as a teenager, kind of, just helping my mom, getting bits and pieces of the story, I could sense a real disconnect from, what my parents understood about my dad's conditions when we would go to the hospital. I just really felt this disconnect, and my family really never, even my dad as the patient, didn't really understand everything that was going on. But fast forward, when he died of a massive heart attack in the emergency room. And by that time, I was entering college and pre-nursing courses, and I made a commitment. I said, you know what, I'm going to be the best cardiac nurse in the world. So I am going to fix systems and processes to bridge this gap between providers and patients, so patients really understand what's happening, and to get on that preventative side. So it's not just trying to put out fires, but how do we get people to make better and healthier choices at home, get access to quality health care, and do those things so they don't end up in the emergency room, so they don't unexpectedly lose their father to a heart attack and things like that. So that's where I started. And fast forward, everything I did in nursing, I was focused on critical care, emergency medicine, cardiovascular health, anything and everything related to those things. I absorbed it like a sponge. And I did a lot of volunteer work with the American Heart Association, American Diabetes Association, getting out into communities. So, it's good to have a clinic and a hospital where people can go to for care, but we know not everyone has access to quality health care. Some people are afraid to go. So let's meet them where they are, and let's incorporate. I knew about health literacy before it was a thing, and, getting out to the communities to really just talk to people about, taking something that they do and just putting a little spin on it so it's a little healthier. And so I've dedicated my career to that. And while I was helping people in the community, I realized that some of my colleagues probably could stand to be a little more sharp in perhaps their assessment skills, or jumping into action, looking to see what are the issues? How can we prevent things from happening? Because I would hear the word non-compliance a lot. And I really don't like that word, because for a variety of reasons, people may not take their medications or go to their doctor's appointments. They don't have a car. They ran out of money because they're on a fixed income. They didn't understand. So I like to use the word non-adherent. So I also, as I progressed through my career, became an advanced practice nurse ×2. I'm a clinical nurse specialist and an advanced practice nurse, and a nurse practitioner. So I actually teach nurses.
Wow.
And some residents entering into critical care and cardiology. So, yeah. So I've always loved to teach.
That's an amazing resume. When you step back, well, first of all, we're really sorry for your loss, but the only good news is your father looks down at us just at all the work you're doing to keep people healthy. What's the one piece of advice you'd give people and families out there that you've learned to kind of keep people healthy? Because to your point, the most important nurse's advice is the advice that keeps you out of the hospital, out of the doctor's
Yes.
office.
Yes. Well, the most important tip that I would tell anyone who's a patient or is just interested in being healthy or living well is, to find a provider who you feel comfortable with and who you feel like you can freely communicate with. Because I think that's the biggest key, communication. If there's no trust, if there's no communication, we can't build healthcare plans or that will keep someone on track. If someone can't communicate with their doctor or doesn't trust their doctor, they're not going to listen. They're not going to take the medications. They're not going to, be apt to change their diet, things like that. So I think really fostering a good relationship with your healthcare provider and building that trust is going to be key. So find someone you feel comfortable with as a healthcare provider. And then from there, I know it's a patient provider relationship, but it kind of becomes family and when you trust your provider, you're going to listen, you're going to ask questions. And that's what I want people to do. Ask questions, even if it's the same question that you just asked me 5 minutes ago and you already forgot the answer. Ask me again. It's okay. So I try my best to make people feel comfortable to do so.
People have a general, speak for myself, like a generally vague idea. There's different types of nurses. Maybe you've heard of an RN, LPN, nurse practitioner, and somebody will say, what kind of nurse are you? And you just said, you basically all the types of nurses. And you did a podcast from going from CNA to LPN to ADN to BSN, MSN to nurse practitioner. And you even hinted that you're not done because you might be getting your doctorate. But what advice do you give people going into nursing? I mean, it seems like that's a lot of where your focus is. And there's so many people that do that. And I think they want to get into it as a helping career, but sometimes they may make the wrong choice or not understand the path. Like what's the pathway and what kind of nurse do you consider yourself to be, since you have all these different, all the different titles?
America's favorite nurse is what I consider myself. No,
okay. Fair enough.
No, but everyone is America's favorite nurse, right? Because I think every nurse desires to help their patient have the best outcomes ever. With nursing school, I took a very non-traditional route because I had to work while I was going to school. Didn't have a silver spoon and had to work, but I didn't let that stop me. Some people will say, well, I'm just going to work, I'm going to save money, then I'm going to go to school. But I knew that would delay my journey into becoming a nurse. So I started as a nursing assistant, got into the environment so I could be around doctors and nurses and respiratory therapists and, learn as I was working. And then I would go to school. So I'd work full time, go to school full time. I don't know how many hours in a day there is, but I got it done.
Yeah.
But I just didn't let anything stop me. So I took baby steps in my nursing career. And actually doing that way, I really appreciated it because as I was going to school and learning something in theory, and, going to clinicals, I could go to work and I would actually see how it really plays out and apply those lessons and ask questions of the doctors, of the nurses. We learned this in school. How does this really work? And so it was really good. But many people get discouraged because nursing school can cost a lot of money. We have a shortage of faculty out there, and actually about 80,000 potential nursing students get turned away because we don't have enough faculty. And and it can get confusing because there are different entry points when it gets into nursing. And then we have these different types of nurses. You alluded to what kind of nurse are you, right? So when we think of the term nurse, there's actually a licensed vocational nurse. Then there's a registered nurse. And then you have your advanced practice registered nurse family, which includes the clinical nurse specialist, the family nurse practitioner, the nurse midwife, and the nurse anesthetist. So there are different types of nurses. And we have different scopes. So and although that might sound confusing, I'll just say there's something for everyone out there. If you want to care for people, there's something out there for you.
What I thought was interesting, one of the many interesting things about your kind of career progression, your educational progression, is I think you mentioned before you'll be training residents as one of the things that you would do. And I think you were noting you're training people that didn't, were learning what was going on, things that you already knew. But then when it came to prescribing, you might have to ask, somebody with similar background to prescribe. And one of the reasons you went to become an NP, but then you became an NP and then you quit becoming an NP, if I understood correctly.
Well, yeah. So funny story about that. So as a clinical nurse specialist, again, I was teaching everything critical care, cardiology to nurses, residents, nurses who've been nurses for a while looking for advanced education. And I was really on the cutting edge of cardiology, considering where I worked. I worked at a hospital that did the most heart surgeries in the world. But I got frustrated because I didn't have prescriptive authority as a clinical nurse specialist here in the state of California. So I went back to school to become a nurse practitioner, which I really appreciated because it really helped me to become a well-rounded professional. So I'm in the critical care department. I see you when you're, heart attack, strokes, and all, after the damage has been done. So going back to become a family nurse practitioner, I really got to come around full circle on the preventative side. And when I graduated, we were in this pandemic. So I became a nurse practitioner at a COVID site, which we did testing, tracing, I did counseling, everything COVID related. And there was a point where it became a real dissatisfier because I'm a cardiology nurse. This is what I want to do. And I actually ended up quitting that job. However, I've not given up on becoming a nurse practitioner. And actually, I do work at an urgent care. You can see I still have my scrubs on here. But so I do take care. I do work as an MP on a part-time status. So, I mean, once you're a nurse, you'll always be a nurse. I think that's something that's hard. It's hard to hang that hat up. It really is. Even those nurses who are retired, it's hard for them to hang up their hat.
So tell us. I mean, this has obviously been a really tough couple of years for all clinicians, for all doctors, all hospitals. But we really believe the burden has fallen hardest on nurses. Tell us a little bit about what the arc of your journey, maybe if you could share, with COVID and why it was so hard, just so that folks have an understanding of kind of the relentless waves of challenge that kept hitting the beach for those who were kind of staffing the front line during COVID.
Yes, and thanks for asking that question, because when COVID was just starting and we were getting an inkling that something was coming, we weren't quite shut down yet, but I had just finished my nurse practitioner program, and I could see the changes that were happening in school because now we wanted people to social distance. We couldn't be, too many people in one place. So it really impacted how we taught in nursing school. So several nursing programs were impacted. And then when it came to work, the biggest need was for COVID related care. However, the nurses in the hospital, because I wear multiple hats. So I'm still in the hospital too, right? The ER and the ICU, I think, were hit the hardest first. And then, it was just overflowing with patients with COVID. So those very, very sick patients end up spilling out into the general wards, and nurses who never had touched a ventilator were having to be quickly trained. Okay, we're going to do a morning 30-minute in-service. This is how you manage a ventilator. Go. It was very, that can be very scary for someone, because the last thing we want to do is to harm someone or not know what to do when someone's sick. But I mean, there were more patients. We've never seen this volume. I think most hospitals, for the most part, keep about like a 75, 80% capacity of what they're capable of. We were well beyond that. We had patients, we had opened up cafeterias, had beds in there. We had cleared parking lots, pitched tents. We had patients there. We had conference rooms. Patients were in there. We had every single ventilator. We would run out of ventilators. I remember several times we ran out of ventilators. And, here we are, code blue, here comes a patient to our ICU. We don't have a ventilator. So me and another nurse are taking turns bagging someone because we don't have a ventilator. We run out of medicines. And we didn't know what we were dealing with early on. It was like fighting the invisible man. And we too are patients. We're health consumers too. So we're here to take care of people, but we too were also afraid of what would happen. And we had a shortage of protective equipment, PPE. We were being limited to, here's one N95 for the week, make it last. And we were reusing equipment. So it was very troubling times where we were frustrated, we were scared, we were overwhelmed, we didn't have enough resources. And I have to say, there are many nurses, because of that experience, who left nursing. They're like, I don't want to do this anymore. This is no longer fun. And not that taking care of someone in ICU is fun, but we were told that we're on the front lines of healthcare, that we were being soldiers. And I don't think nurses, we didn't sign up for the military. We signed up to be nurses. And so it was just a real scary time. And, we had a lot of colleagues as well as patients die. And that was very traumatic, because although in healthcare as nurses, we encounter death, not at the volume that we were seeing. it was actually so disheartening. Our morgues were full, mortuaries were too full to take care of patients. They rolled in, big trucks where, we were making makeshift morgues. It was very sad. It was very sad. And patients.
So emotionally,
Mhm.
but emotionally, you got through it. You've got this sparkling charisma. Like, how do you get through it in those sorts of circumstances? Because it does. I mean, that's why we did the episode on whether it's worse to be a nurse. But
Yeah.
how do you? Where do you look for that resilience?
Oh gosh. And thank you for saying that I have resilience. I think back to my dad's experience and the type of nurse that I would have really wanted him to have. Someone who does, who does everything my dad needed, explain things, was caring. The hospital is a very lonely place. No one ever wants to die alone in the hospital, and that's really what happened during the pandemic. So I looked at each patient as my family member. Like, what would I want to, what would I do? What would I want for my loved one if this were my loved one? And I just, people were very thankful. There was one lady, I'll just tell the story real quick. She was the least sickest of all the very, very sick patients. She wasn't intubated, but she had a BiPAP mask on. And because she wasn't as sick as the others, she wasn't visited as often because she was doing well, right? We had to tend to more critical patients. And I took the time to go in there. She was Spanish speaking. I know some Spanish, spoke to her in her primary language, gave her a bed bath, turned her, gave her a back massage, cleaned her sheets. You can tell nothing had been changed. But again, we're in pandemic mode. So, everything is scarce. But I did those things and she cried and she actually gave me a hug and was, so thankful for that. And those things mean a lot to me. They really do. So those were the things that I drew from to help keep me going, knowing that I was actually literally helping someone and touching someone's life. Now, I'll say not all my colleagues felt the same way, especially when, you had travel nurses coming in making 2, 3 times, 4 times what they were making as they were working side by side. So there are a lot of moving parts during this pandemic. But I think for the most part, most nurses, they love being a nurse, but it was just the work conditions during this pandemic that drove many of them away.
You've talked a fair amount about having a mentor and the importance of having a mentor. And I'm wondering, do you have a mentor? Have you had multiple mentors? How do you think about that?
Oh, yes. I think mentors are absolutely necessary. And I have mentors, some who are nurses, some who are lawyers. I have them in different disciplines because I think that's important. Because I never want to have my blinders on and think that if I'm just talking to a nurse and getting my mentorship from a nurse, that's going to be reflective in all the spheres that I work in. So, but having a mentor, someone who you can talk through your problems with, or just present a case like, hey, I'm going through this at work. I feel like this, I want to do this, but what are your thoughts? Because I think that's important. And I have to say, I have been very strategic in my career because I've had some really great nurses and other mentors of other disciplines to walk me through things. I've had business executives, nurses, attorneys walk me through things. And with their specialty, like the attorney, obviously, well, legally, you want to consider this, this, and that. And then the finance person's like, well, financially, I think this is the better decision if you do this, this, and that. And, it's helped me to actually be very strategic and really make the most of my career, which is I'm really excited about. So whenever I have the opportunity to do it, I love like turning around and mentoring other people as well whenever they ask me. So, but you got to have a mentor. I think that's key to survival when it comes to your to working in this healthcare profession.
John, does it put me at too much of a weakness if I say that you've been one of my mentors?
That would explain why you haven't progressed. So, Driscoll, I talk a little bit about that traveling nurse phenomenon. When I talk to nurses and doctors, they see it as so disruptive and so necessary and so expensive. But I do think it kind of really messed up the culture of a lot of hospitals and care. But if you're not on the inside of healthcare, it's hard for folks to understand, like, isn't a traveling nurse a good thing? Like, what is it? What was the impact
Mm-hmm.
And where do you think we go from here in terms of meeting our nurse capacity?
That's a great question. So I think travel nurses are an absolute necessity, and they've been lifesavers many times, even before the pandemic. Whenever there's been a shortage, or maybe there's been a walkout, a strike by some nurses, the hospitals have been able to continue operations because they've been able to have a group of nurses come and temporarily fill needs. And these are travel nurses who are willing to fly to different states and different locations, work in different hospitals. So, it really helps to fill a need. And so that's great. Now, travel nurses, with the pandemic, travel nurses were called upon. So I know I had a lot of friends who traveled to New York. New York was like, hit so hard, one of the first places to hit so hard, shortage of nurses. Travel nurses went to New York to help with the pandemic. But during this time, because of the kind of hazard of COVID and the need, I mean, total need, they had no supply of nurses. That hiked up the prices for travel nurses. And some people say, well, that's not right. They shouldn't have done that. But if you look at any other product that we utilize in the United States, whether it's a service, a product, whatever the case may be, when there is a high demand, low supply, it drives up prices. So there's been an increase in travel nurse pay. Some people don't like that at all, especially because some of the people have taken advantage of that. I will say that the prices were too crazy. It's disrupted the financial sphere of healthcare, if you will. And, I honestly don't believe it's sustainable. Healthcare is already very expensive. And you guys probably know more, know just as much about this, but we can't continue to have a quality healthcare system if, there's one particular service that's taking all the money. So we have to figure out a way how to level out the playing field here. But I will say that it was supply and demand, it was the hazard pay, and it was because hospitals have not appreciated many of their nurses and put them in terrible work conditions. So they say, if I'm going to work in a terrible work condition, I'm going to get paid for it. So that's what's happened. But the way to fix that is we have to change the culture in these hospitals so nurses feel appreciated. Because, listen, I would rather work somewhere in a healthy work environment and maybe make $1 less, but I'm in a healthier work environment. I feel appreciated. I feel welcomed. I have supplies. I'd rather do that. So we have to do that. And then we also have to get our nursing programs up, back up and running. We need more qualified nursing faculty to do that. We simply just do not have enough. And that's because nursing faculty are not paid well enough. So we don't have nurses who want to be teachers because they're not getting paid. So we really have to look at who's getting paid what and really strategically put our money in the right hats. We got to pay our nursing educators a lot more money so we can attract great teachers, so then we can train our workforce, have more nursing students go through. And then also in the hospitals and clinics, leadership has to change the work environment, the culture on their units, so nurses will feel welcomed and want to stay somewhere.
That makes sense.
Just
Alice, I forgot to.
Well, just to be clear, it's actually we're reversing, because we pay the nurse educators about 60 cents on the dollar of what we pay nurses. We don't have enough nurses, which is why we've got these travel nurses, in some cases being paid twice as much, that jump around. And so you've got an unstable core system.
Yeah.
That I totally agree with you, Nurse Alice. We have to solve that problem and start by, I think, perhaps being a little bit more flexible on immigration, because you've also got about 100,000 people who could come in from outside the U.S. who are qualified. You got to educate more of the folks who are qualified, and you got to pay the educators and the regular nurses a fair wage.
Absolutely.
So that they see a path forward. But David, I want to ask the critical question, which we sort of posed without really knowing enough to our expert here. Is it worse to be a nurse right now?
I'm gonna. So you're asking someone who's always glasses half full. So I'm optimistic. Now I will say it's been some very trying times, but I think because so many things have changed and moved, it's an excellent time to kind of create a solution to the several problems that you have now. There's so many problems going on that, if many nurses have actually they've become more entrepreneurs. They've expanded outside of the hospital. So I'm going to say this for nursing. If anything, it's opened the eyes of many nurses to recognize and all of the wonderful things that they can do. Like, I don't necessarily have to work at a hospital. I can work at a clinic. I can open my own business. I can work contract, which I will say, by the way, although we have travel agencies that contract these travel nurses and staffing agencies that fill the needs of hospitals, my forecast is that nurses will learn how to contract individually with hospitals. I think that's going to happen, but I don't think it's a bad time to be a nurse. This is actually a great time to get in because the demand is high. We need nurses. So if you're looking for a job, listen, there's plenty of work for you. You're not going to be out of work, and you're going to have plenty of places to choose from because no one has enough nurses.
So awesome. I mentioned in introduction that you have become, pretty well known on TV and on radio as a nurse, healthcare expert. Now, a lot of times you have people that is often physicians, that are on TV and radio. So how did you become a media health expert as a nurse?
A media star, David. A media star.
Okay.
Oh, John, don't suck up to the guest so much. You already told her she's great. We know she's excellent. Yes. So, how did you do it?
I never thought in a million years that I would be doing that. I literally was in the right place at the right time. As I mentioned earlier, I was doing a lot of volunteer work with the American Heart Association. And, there would be health fairs and no one ever wanted to come by and get their blood pressure checked. So I would be engaging, trying to borderline, funny, cracking jokes, trying to get people to come by and, being animated as I educated. So it kind of drew a crowd always to the blood pressure booth. And then there would be a line and someone from American Heart walked by and they're like, this just doesn't happen. Like, Nurse Alice, you have a way with people. Like, would you be interested in going on the radio to talk about how to be heart healthy during the holidays? Sure, I'll do it. Okay, then they invited me back. How can you talk about the signs and symptoms of a stroke? I did that. And so I started to do media on behalf of the American Heart Association. And as I would go to these radio stations, these producers and these folks, they move around from station to station, from radio to TV, and they kind of carried me with them. So they actually would invite me back to talk about different things outside of the American Heart Association. And I started doing enough of these things. And then I created a website and I put, education information on my website and I put the videos up. And next thing I knew, people were just calling me. And I said, oh, well, how did you find me? Oh, we saw your videos online. And so I would say that it's just something that I fell into. I never really sought it out. But once I saw that take off, I did take some journalism classes, some broadcasting classes, some improv to make sure that I was prepared to handle whatever is thrown my way on television because you only got 3 minutes and sometimes some reporters aren't as nice in their questioning as others. So you have to be prepared. I equate it to just like if I was going to go to a new unit to take care of patients, I would want to orient to where's the crash cart, what's the medication room, who are my resources, just knowing the lay of the land. So that's what I did when it came to journalism and broadcast. And it just kind of just took off and became this thing. And long story short, I would never forget. I did Dr. Oz, Dr. Drew, and the doctors all in 1 week. That's when I knew that was it. And then I got picked up by the local news station here in Los Angeles. I used to be with KTLA, but then now in current state, I'm medical correspondent for NBC Los Angeles and a nurse. Right. So I'm so glad about that.
Excellent. John, last question to you.
Well, Nurse Alice, don't you think media and America needs more nurse experts on health could speak with kind of heart and insight?
Yes, and we do. And so, in fact, I have been working with the American Nurses Association, starting here with California. National
Awesome.
Office is going to be taking this out. But we've actually created some media training programs for people who aspire to do that. We have lots of nurse researchers out there, a lot of things that we as nurses do, a lot of issues that are also important to us, our profession, our practice, and, training people how to pitch to the media, how to do your press release, how to handle a 3-minute interview with maybe a challenging interviewer, and how to just show up as your best self And I think that's one of the things that's most important, being authentic. Nursing is the most trusted health profession for the last 20 something years. And to your point, you mentioned something about being a nurse and not a doctor. I'll say when I started this, I would sometimes get trumped like, oh, Nurse Alice, thank you so much, but we're going to go with Dr. So-and-so. But after a while, just being consistent and not giving up, it was the personality and the easeability, I don't know if that's a word, of how I spoke to people that made people feel comfortable. And so then I began to trump doctors when it came to being on television. They said, oh, Nurse Alice is so much nicer and kinder and when she says stuff, and people understand her because I would use health literacy. So, but yes, long story short, we are training more nurses to do that. There's about, I think, 3 to 4 nurses for every 1 doctor. So by just sheer numbers alone, you should see much more of us on television than you do physicians.
Well, I just wanted to thank you, Nurse Alice, for joining us and for lifting up not just patients, but your profession. Thanks so much.
Thanks so much.
Well, that's it for another episode of CareTalk with special guest Nurse Alice Benjamin. You can follow her at asknursealice.com and on Twitter, Facebook, and Instagram at asknursealice. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. If you liked what you heard or you didn't, please subscribe on your favorite service.